If you thought that your heart palpitations were somehow related to your stomach or your GI tract, meaning what your gastrointestinal tract is doing, you are quite right. Yet you might have been very frustrated over some passage of time, maybe finding yourself going to the ER in the middle of the night because you're having heart palpitations and you're worried that you're having a heart attack, only to be told your heart is perfectly fine. Yet as you live with this for longer, and you know you have heartburn, or you have gas and bloating, you have constipation, you feel a lot of pressure in the area of your stomach, you've got shortness of breath, sometimes you feel anxiety, and you know, it's your body. You've been living with it for a while, and you really start to be suspicious that these heart palpitations you're finding, maybe elevated blood pressure even, really have this interrelationship. But when you speak to your cardiologist about it, or you speak to your gastroenterologist about it, you're looked at like you're crazy, or you're certainly given no validation to your suspicion. There is a doctor by the name of Ludwig von Roemheld, and Dr. Roemheld actually lived from 1871 to 1938, and he claimed, quite right, and named after himself eponymously, the Roemheld Syndrome, where he described exactly what you and I were just talking about, which is that there is a relationship, the way he talked it, a cluster of heart symptoms stimulated by gastrointestinal, meaning stomach, colon changes, resulting in heart palpitations and slowing of the heart. And then I'm going to describe to you why it actually starts with slowing of the heart, and then the heart reacts to that. But some of the symptoms associated with this syndrome is not just the heart palpitations, but the shortness of breath, fatigue, anxiety, tachycardia, where the heart's, beating very quickly, anxiety, I think I said, cramping feeling in the muscle, feeling very tight around your diaphragm area, sleep disturbance, dizziness, or vertigo. So if you have all of those symptoms, or you have several of those symptoms, I really want to explain to you what's going on. And he also quite rightly talked about the fact that some of the causes were excess gas, constipation, sometimes gallbladder issues, and hiatal hernia. So he actually mentioned way back in the early 1900s, hiatal hernia and this association with the heart. You'd be interested to know that the Roemheld syndrome is considered obsolete, and that is why your doctor was not trained on it, and that is why they look at you like, you don't know what you're talking about when you're trying to explain to your doctor that you feel your heart issues are related to gastrointestinal imbalances.